name is Crystal Perry. I'm a registered nurse in the BSN program at the College of Central Florida. Today I'm going to discuss with you the importance of a self-breast exam and how to properly perform one. Self-breast exams are very vital in individuals identifying their own breast changes, and in result leads to them getting early treatment and positive outcomes as a result. It is a two-part method. First part is visualization, and that's usually performed standing or sitting. With that, you're able to notify color changes, shapes, swelling, discharge, symmetrical changes as well. And with the palpation aspect of it, you're able to notify the nodules, if there's any swelling or any tenderness. So the first part, I would say it's easier for an individual to stand, especially in front of their mirror for this part. With this, you're going to place both your arms on your hips with your shoulders back. You're going to take a look in the mirror. You're going to look for any color changes. You're going to look for any swelling. You're looking for shape changes. Is one side bigger than the other? Is one side sagging a little bit more than the other? Is there any discharge coming out of your nipples at this time? As you're taking a look and observing what's going on with your breast, go ahead and take your arms, move them in, and lean a little bit forward with your breast. At this point, this is going to help you to look at the symmetry of your breast and of your nipples. After you've observed for a minute or so, take both your hands and your arms, and you're going to lift them up above your head in front of the mirror. This is going to pull the skin taut across the breast. This is going to allow you to see any obvious nodules. It's going to also let you accentuate any dimpling if there is any present. Now that's the ending part for part one of the exam, of the visualization aspect of it. Next part is going to be your palpation. With that, you're going to lay down on a flat surface on your back. Now, positioning for this is one arm behind the head. Now, whichever side you choose with, I'm going with the right side here. You're going to place a pillow corresponding on that side up underneath you. And you will use your opposite hand to perform that breast exam. Now, when you finish that side, you're going to switch left hand behind, pillow behind that left side. Right hand will be used for that palpation part. Now, on the hand, you're going to use the 3 middle fingers, and you're going to use the pad parts, not your fingertips, the pads. It enables you to feel evenly across the surfaces of the breast. So there are 2 pattern ways you can palpate for this exam. You can do what we call the vertical pattern, which will go up and down, overlapping from one side to the next. Or you can do the circular motion, where you will start and move your way down and around and work your way in towards the nipple. The starting point on both sides of each breast will be your tail of incidence, which is right by your axilla area. Here, it's the upper lateral quadrant of your axilla. And here you're going to start with the palpation here. I prefer the circular method. So from here, you will work your way down and around, down towards your broad line, up and around towards your sternal edge, and back up. And you will work your way in. Once you've palpated on this side, you're going to palpate the opposite side using the same exact pattern that you've chosen. Now, when you begin in the tail of incidence, you also want to continue to palpate in your axilla and up in your scapula area and your arm. If there are any abnormalities, any nodules that you feel that may be enlarged, that could be a sign of infection in the breast, in the arm, or even in your hand. Those are changes you definitely want to notate and let a physician know as soon as possible. Now, when I say you're feeling for abnormalities, for tenderness, does it hurt more than it normally does? Is it extra warm than it normally is? The nodules. When I say abnormal, you're feeling for pea-sized, marble-sized, even walnut-sized nodules. Are they stagnant? Are they moving? Are they firm? Are they soft? These are characteristics you need to notate down so that when you do contact your physician to have them take a look, you're able to describe it to them and know exactly where it's at so that they can examine that same area that you had found your possible changes. Now, after you've performed one side self-breast exam and have worked to the other side, you're going to now examine your nipples and areolas. You're looking for the color changes of the nipples and the areolas. Are they equal? Is one darker than the other? You're also going to gently apply a squeeze. You're looking for any discharge or drainage. You're looking for any redness, any retraction of the nipples, any other skin changes. Please make a note of it as soon as possible, as soon as you know. Now, this test you can perform on yourself once a month. The preferable method is once a month around the same time each month, and that is to ensure consistency. You don't want to perform one exam at the end of the month, quickly perform another one at the beginning of the next month, and then wait till the next beginning of the next month or end. It's not accurate amount of days in between. You want to allow for consistency. That's how you're going to be able to notice any changes and keep accuracy with it. It's very important for you to know your family history. Definitely talk to family. Is there any family history of cancer, of breast cancer among the family members? If so, you definitely want to make a note of that if you do follow up with your physician. With that being said, then you can discuss, when would be the appropriate time for you to begin screenings with that knowledge of history. They may have you wait a little bit later depending on what the family history is, age-wise when it first onset, or they may have you start a little sooner just so they can get a head start and keep a very close eye. With screenings, we're referring to mammograms, we're discussing possible ultrasounds, CTs, and with that being said, again, early detection is the best way to keep this under control, best way to get positive outcomes with treatments. If you have any concerns at all, if you have any worries, any changes, please be sure to follow up with your doctor immediately. And that's all I have for you for the self-breast exam. Thank you.